name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri. This is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. Today's topic is so useful. It's going to be 3 ways for you to control your anxiety disorder and panic attacks. If you've never joined us before, we love uploading videos to approach medical topics from an integrative medicine perspective. So we upload 1 to 2 videos a week. So please subscribe and hit the notification bell so you know when our next video has been uploaded. And midweek we like to give like a little check-in, just to give a little snippet, because we miss you guys and we enjoy when you stop in. If you like this video, give it a thumbs up. We appreciate it. Dr. Lucy is going to give a summary and then we'll go right into the 3 ways that you can control your anxiety disorder and panic attacks. When we have panic and anxiety, we feel out of control. And what's worse is we give you a prescription and say, oh, don't worry, we know you can't control yourself, so here's a pill. And when you have panic attacks, here's another pill.
Well, first of all, when you have anxiety, you have to understand that there's probably 5 basic categories of anxiety: generalized anxiety disorder, social anxiety disorder, obsessive compulsive disorder, phobias, and PTSD. And these all things can manifest with symptoms of extreme anxiety. So not just one diagnosis covers everything. There's some medical conditions you really need to look into to make sure that's not what's causing the problem or result in it. For example, there's some heart issues can actually cause anxiety, respiratory issues, problems with your lungs, some tumors, thyroid diseases, of course.
As well as adrenal fatigue syndrome, which is also now known as adrenal burnout syndrome or hypothalamic pituitary adrenal axis dysfunction.
So when you go see your family doctor, and we recommend that you do, especially if this is interfering with your life, they're probably going to run some blood tests, most likely check your thyroid, maybe your B12, and some other tests, just to make sure that some of these conditions are not already existing and causing these problems.
And a lot of people that have anxiety actually are found to be low in magnesium levels. And what's important is actually only 1% of magnesium is extracellular, which means we need to know what's in those red blood cells at the bottom. So ask your doctor to run an RBC magnesium, which is the most accurate way to measure your magnesium levels.
If you're taking certain medications, that can actually increase your risk of anxiety. And some of the most common ones are some of the over-the-counter decongestants that you take for colds, or even people that are taking inhalers. That can also cause, if you take it frequently enough, can cause anxiety. And oddly enough, there's some supplements out there that can actually elevate your level of anxiety. Probably one of the most common ones is something called SAM-E that we use a lot for depression, and I use it for pain, joint pain. You always have to have a very organized approach to people that have anxiety. It's not just something that's in the brain. The actual cause of anxiety, how it occurs in the brain, is pretty much unknown. The center of the brain, called the amygdala, and this seems to store the memories that you had that would trigger these responses to danger, and this seems to be where in the brain that this is centered. When we start to discussing integrative approaches, one of the first things, and you'll see us talk about even some other chronic diseases, is exercise. Now, we've talked about this in other videos as well, but it's extremely important even with anxiety. And the studies with anxiety show that the people that exercise at least 12 minutes at a time for 10 weeks start to get the improvements in generalized anxiety disorder. The benefits start to peak even at 40 minutes. So it's a good idea to, if you're not exercising already and you're having anxiety, this may be one of the first things you can try. Also, too, it's a type of exercise. Now, this tends to be thought that aerobic exercise is better than anaerobic exercise, which is classically thought of as weightlifting, versus, like, say, biking or running or rowing or something like that. But any exercise that you do is beneficial. So if that's all you can do, that's okay.
So it's better to do biking, running, rowing than
powerlifting. Now my personal opinion with this is I always like it. I think it's a good idea to be balanced. The second thing is nutrition. You really need to monitor your caffeine use. Even alcohol has been shown, especially if it's in excess, it can trigger anxiety. And deficiencies in omega-3 fatty acids can also increase in anxiety. Now, also too, nutritional deficiencies can be created, in terms of minerals, can be created by malabsorption issues that you have, and sometimes people recommend that you receive minerals through IV supplements versus, say, taking a pill. They tend to be better absorbed in the body.
Yeah, our patients do find results. IV nutrients are vitamins that go through your IV, so you're getting 100% of the vitamins you are taking in because it's going right through your IV right there in our office. It only takes like 45 minutes to an hour. And because if we eat oral vitamins, we only absorb about 60 to 70% of what we take in.
In terms of supplements, probably one of the most common that we see people treated with anxiety include most of the B vitamins, the B12 and B6. Those deficiencies can cause increase in anxiety. Also recommend doses of magnesium as a supplement, which can also help. One of the other deficiencies that needs to be addressed, as I mentioned, folic acid. Folic acid, if you have a deficiency in it, actually, then the antidepressants that you have been prescribed tend not to work quite as well. The thing that is used as well is something called 5-HT, 5-hydroxytryptophan. This is a precursor to serotonin. That's a neurotransmitter in our brain that we need to function. And that has been recommended as a way to help decrease anxiety. There's also something called L-tryptophan that actually is a precursor to 5-HT, which is a precursor to serotonin, and that also has been recommended as well. There are some side effects that occur with those, so you have to be careful. Botanicals are typically natural herbs that we've prescribed even for some of our other chronic disease issues. One of the most common in Europe and the US is something called kava, K-A-V-A. It's let me give the dose on a slide. They've been in Europe. It's actually recognized as an accepted initial treatment for anxiety, and we can get it here in the U.S. typically in the form of a tea. I think there's some tinctures as well that are offered. The interesting thing about kava, when you look at the mechanism, how it works very similar to some of the pharmaceuticals that are considered, what are they called, benzodiazepines, that are prescribed very frequently to help with anxiety. The effects tend to be a little bit milder than some of the prescription things, so if you're actually looking for something that's more of a gentle way to treat it, it's probably a good choice to take. The thing that you have to remember is that if a patient has Parkinson's disease or liver problems, kava is probably not a good first choice. One of the other botanicals that are frequently used for anxiety include Valerian Root. We oftentimes prescribe it for sleep, especially if melatonin's not working very well.
And you can use Valerian Root for just, if you tend to be like a nervous person, take it in small doses through the day.
The interesting thing about Valerian Root is that you'll see oftentimes products that combine St. John's wort, which is used for depression, and passion flower, which can actually also help with anxiety as well. Again, understand Valerian Root, as we mentioned in another video, it takes a while for it to start kicking in, sometimes weeks before you start seeing the effects. There's some other botanicals such as lavender, and we're going to actually list a couple of others that are included as well.
Mm-hmm.
Before we get to the last topic, I do want to stress that there are a number of prescription remedies out there that your physician may prescribe, but understand that these are perfectly acceptable, and if you can tolerate the side effects and it's working for you, that's okay. Typically, a lot of my patients will want to try some of these integrative medicine options first before they get to the prescription strength medication. That's perfectly okay, and sometimes you can use those at the same time.
Well, I also take an approach, as our patients know, that I like to know why it happened. You want to be under the care of like a psychologist or a psychiatrist. Talk through why you think is the cause of the anxiety. If it's not a medical problem, it's not medications. That's why we like to go into evaluation for adrenal fatigue syndrome, because if you fix that, then you don't have to be painting the house with an anti-anxiety pill. Next thing is we are going to teach you mind-body therapies. Mind-body therapies are extremely effective and evidence-based. The first thing that we recommend is that you get involved in some kind of mindfulness-based stress reduction. The other thing is that you do want to do some sort of breath work. You're going to do the 4-7-8 breath or the square breath twice a day. The emergency breath is called Bellows Breath. So every day for anxiety and panic, you're going to do a maintenance breath, either the 4-7-8, which we've showed you before, and I'll demonstrate it quickly, and then we'll introduce a square breath midweek. The rescue breath we'll demonstrate today, the Bellows Breath. So what you're going to do is you're going to actually breathe in the nose for 4 counts. This is 4-7-8. Hold it for 7 and let it out for 8. Last one. That's 4 cycles, and you do that twice a day. So that is your maintenance. That already activated your parasympathetic nervous system to calm everything down. You probably already feel a lot better doing it. Then, the minute you start feeling your panic attack occurring, grab onto this. It's called the Bellows Breath. It's really important. It's rapid choo-choo breathing through the nose, so you keep your mouth shut the whole time, and it's for 30 seconds. So it looks like this. You've got the panic attack, you know you're going to die. Most people feel an impending doom. Grab it and let's go. So that was 30 seconds of a bellows breath through the nose.
So with regards to bellows, how often can people do this? Is it just a one-time thing, or
You
they
can
just
do it
keep
as
doing
often.
it until their panic
It'll
attack
stop.
goes away?
It'll stop. I've seen it happen. If you need to do it twice, go. You won't need to. It works the first time. Was doing a delivery, and the head's starting to come out, and I look up, and the father of the baby was starting to do this thing, and I looked at the wife, my patient, and I said, "What's going on?" And she said, "He's about to have a panic attack." And I asked the nurses, I said, "Please take off my mask." And I looked at the man and I said, "Look at me, do this." And he got through it, and he was able to enjoy the birth of his baby. It works, but you've got to practice it, because you don't want to be there at the time of impending doom and then figure out, what was she talking about? Do I breathe? No, it's not that. If you do that, you're going to pass out from hyperventilation. You need to always do it through the nose. It's very important to practice that rescue. You're not going to hurt yourself by doing this 3 times in a row. Now you have the power. You have the power to control your anxiety disorder, so you don't have to worry if you have a job interview that you'll embarrass yourself or not be able to keep the appointment. The other thing that works really well for people is something called autogenics training. You can find it all over YouTube, and you're supposed to ideally do it morning, noon, and night.
Also, too, one of the other things that can be used is psychotherapy or cognitive behavioral therapy. This is where a trained behavioral health provider does sit down with you and kind of explores those possible causes of your anxiety.
So they have to be a cognitive behavioral therapist.
Right, you have to
Okay.
be trained to do that. Well, that's all for today. Thank you for watching us. Our next YouTube video will be in approximately 2 weeks. We'll get back to you, and during the week we'll have some mini presentations for you that will help you live.
Thank you for joining us. We hope this is helpful. We love feedback. Please leave them in the comments below. And also share what you use for panic, what you use for anxiety that's worked, so we as a community can help each other. We'll see you between Tuesday and Wednesday for our midweek J&J House Call check-in to teach you how to do the square breath.
So long.